2015年嘅第11條題目啦，又係去到寫文啦。今次嘅主題咧就係循環系統。今次我哋想講嘅咧就係動脈同埋靜脈啦。咁佢哋兩者雖然都係血管啦，但係佢哋嘅結構咧就好唔同。兩條題目咧，我哋就要學識拉關係啦，就要將佢哋結構上面嘅差異，同埋佢哋用唔同嘅方法去維持翻血液喺血管入面流動嘅呢個功能啦。咁兩者有咩嘅關係呢？咁啊，先睇翻三部曲咯，成條題目啦，我哋點樣去思考呢？第一啦，有咩嘅 keywords？動脈啦、靜脈啦、結構差異啦，同埋點樣維持血流啦。第二啦，就係 precaution 啦，有啲咩嘢需要寫，有啲咩嘢係唔需要寫嘅。咁我哋呢條題目呢，有兩個重點。第一個重點呢，就係動脈同埋靜脈嘅結構差異啦。佢哋嘅血管壁厚薄有咩唔同呢？邊個有反膜，邊個冇反膜呢？呢兩條血管嘅內腔究竟邊個大啲，邊個細啲呢？第二個重點呢，就係動脈同埋靜脈點樣去做到佢哋嘅功能，維持血液喺血管入面流動啦。咁下面呢，我俾咗4個因素嚟嘅：血壓嘅高低啦、血量嘅多少啦、血流嘅方向啦，同埋血嘅成分。記緊翻 precaution 係教曉我哋究竟有啲咩嘢需要寫，有啲咩嘢唔需要寫。喺今次我哋講嘅係維持血液喺血管入面嘅流動，所以啦，血嘅成分我哋係唔需要講嘅。跟住到第三呢，就係整題嘅答題框架啦。咁啊，由於呢條題目呢，係要我哋去指出動脈同埋靜脈嘅結構差異啊嘛，咁即係要我哋做比較啦。咁所以記緊啦，做翻完整比較啦。而跟住咧，就要將呢個結構嘅差異同埋佢哋嘅功能咧，又要拉上關係。所以啦，我哋就要去配對翻一個相關嘅結構差異，同埋啦，佢哋用咩嘅方法去維持血液流動咧，就拉上關係啦。亦即係將結構同功能拉上關係，亦即係我哋喺生物科成日見嘅適應性特徵啦。咁啊，大家快手 download 翻份筆記咧，我哋就繼續向前行咯。今次呢條 essay 咧，係要我哋做比較同埋描述嘅。先睇下左手邊嘅框架啦。咁首先咧，我哋就要有翻動脈同埋靜脈嘅結構啦。咁我哋啦就要去揀翻一啲適應性特徵。咁記緊頭先我哋講過啦，適應性特徵就係將結構同埋佢嘅功能拉上關係。今次呢個結構咧，唔係淨係講話動脈或者靜脈嘅，係講緊呢兩條血管嘅結構。例如啦，佢個血管壁啦，例如咧佢個反膜啦，同維持血液喺血管入面流動嘅功能啦。所以咧，呢一條題目係好考我哋要揀正確同埋相關嘅結構去講嘅。都有一樣嘢我哋要留意嘅，我哋就唔能夠好簡單地就去指出翻動脈同埋靜脈嘅分別就算數。呢個分別係結構上面嘅分別，同埋關個功能乜嘢事呢？咁下面咧都係兩個錯誤示範嚟嘅。第一個就話啦，動脈所運送嘅血咧，佢嘅血係由心臟去泵出嚟嘅。心臟嘅跳動咧，就係將啲血推動嘅力量啦。而喺個靜脈入面嘅血，佢嘅 driving force，佢嘅推動嘅力量咧，係嚟自於骨骼肌肉嘅收縮，而咧就擠壓靜脈，就令到靜脈入面嘅血咧就流動嘅。啊，呢一句咧，你會發現啦，梁 Sir， 我咪講咗結構咯。嗱，心臟係個結構啦，骨骼肌肉都係結構啦。跟住啦，令到血液流動喎。嗱，心臟就泵血啦，跟住啦，骨骼肌肉收縮去擠壓個靜脈，啲血又會流動啦。我咪講晒兩樣嘢咯。No， 因為你講緊嘅係心臟同埋骨骼肌肉，佢哋自己本身已經係個結構啦。今次我哋講緊嘅係動脈同埋靜脈自己嘅結構。呢一句係冇回應到題目嘅血管結構差異。第二句嘅錯誤示範咧，就係講動脈咧就係將啲血帶離開心臟。而靜脈咧就係將啲血帶去心臟。我未講咗血液流動咯，梁 Sir。嗱 ，blood flow 嘛 ，away from the heart towards the heart， 講晒俾你聽啦，好巴閉啦。咁個結構係乜嘢啊？你淨係講翻個動脈同靜脈啫，佢有冇結構性差異啊？你有冇講到啊？冇講到。呢兩句都唔係答緊題目嘅，所以 level 1你就要識得揀一啲啱用嘅特徵同佢嘅結構拉上關係啦。第二啦，有咗結構之後就要比較咯。咁所以我哋就要比較一啲相關嘅適應性特徵。咁由於今次要做比較，自不然就用翻全視技能嘅完整比較。完整比較喺今次呢條題目，由於我哋要講差別啊嘛，係話我哋要講啦，動脈咧就咁，靜脈咧就點。今次嘅完整比較就多咗一重意思啦，就係公平比較。下面有兩句句子俾咗你嘅。第一句咧就係話啦，靜脈嘅內腔係比動脈嘅內腔為之大。 第二句咧就講啦，動脈嘅內腔較為細，而靜脈嘅血管壁咧就有較為薄嘅彈性組織。呢兩句我都係做緊比較喎，梁 Sir， 邊一句係真正嘅完整比較呢？第一句先係，點解啊？因為第一句真係攞緊內腔嚟做個比較啊嘛。但係你睇下第二句，前面動脈就講內腔，後面靜脈就講血管壁，公唔公平啊？完唔完整啊？唔完整喎。你會發現動脈結構 A 同埋靜脈結構 A 嘅比較，你唔會攞結構 A 同結構 B 去比較嘅，因為咁樣係唔公平。比較完啦，就拉翻去呢個功能嗰處，就話翻俾我聽呢個結構係點樣維持血液喺血管入面嘅流動咯噃。咁所以啦，我哋首先咧就要識得揀翻啲結構啦。呢幅圖咧又係書度輯出嚟嘅，動脈靜脈有咩嘅分別啊？血液流向啦、位置啦、入面運送嘅咩血液啦、個推送嘅能力啦、血壓高與低啦、血管壁啦、血管內腔啦、有冇反膜啦。咁喺呢8個差異入面啦，邊啲先係結構性嘅特徵啊？得右手邊呢3個係咋，左手邊呢5個全部都唔係嚟噶。好，咁我哋先去講下咧第一個結構啦。今次我想比較嘅結構咧就係血管壁嘅肌肉層啦。動脈咧嘅血管壁肌肉層咧就厚啲，靜脈嘅血管壁肌肉層咧就薄啲。咁喺呢兩者嘅差異比較咗啦，咁同佢哋維持血管內血流嘅方法有咩嘅關係呢？今次我哋嘅重點咧就喺動脈嗰處。由於啦喺動脈嘅血壓係為之高，咁係因為啦我哋心臟泵血嗰下咧就能夠產生一個高嘅血壓，將血咧運送去身體各部分嘅。正就係呢個原因，動脈有一個厚嘅肌肉層就能夠承受到一個高嘅血壓，令到血液咧係能夠喺個血管入面流動啦。你會諗吓關咩事啊？梁 Sir 嗰個肌肉層嚟嘅啫，佢唔識收縮噶。嗱係啊，啱啊，佢唔識收縮噶，佢係一浸好厚嘅肌肉層。佢之所以咁厚，係純粹承受咁高嘅血壓噶咋。咁關維持血液喺血管入面流動乜嘢事啊？幻想下喺靜脈，佢一個較為薄嘅肌肉層，又甚或乎係微血管，佢連肌肉層都冇嘅，係咪好容易因為高嘅血壓而爆咗啊？防止血管受破壞，令到啲血逼咗出嚟啊，咁樣先能夠維持到血液喺血管入面流動噶嘛，係咪？跟住啦，就到第二個結構啦。今次我想比較嘅咧就係血管壁嘅彈性組織啦。喺動脈咧就有多啲嘅彈性組織，而靜脈咧就有少啲嘅彈性組織。咁又同維持血流嘅方法有咩嘅關係啊？我哋又係睇翻動脈啦。正如頭先我哋所講啦，由於心臟泵血喺動脈入面有一個高嘅血壓，而呢個彈性嘅組織咧就容許到血管有一個回彈 recoil 嘅作用啦。但係當有高嘅血壓流過動脈嘅時候咧，個彈性嘅組織會伸延，而伸延咗之後，由於佢有彈性啊嘛，佢就會回彈翻，就將啲血繼續向前去擠佢啦。呢個都可以維持到血液喺血管內流動嘅。跟住去到第三個結構啦，今次我想比較嘅咧就係血管入面有冇反膜啦。咁啊，動脈咧就冇反膜嘅，而靜脈咧就有反膜嘅。咁同佢哋維持血流呢個功能有咩關係呢？今次我想聚焦嘅咧就係講靜脈啦。咁當啲血流經微血管之後咧，佢嘅血壓咧係會大幅下降嘅。咁所以喺個靜脈嘅血壓咧就較為低。咁我哋有咩辦法令到啲血真係可以繼續向前行呢？咁自不然啦，就真係要靠翻咧骨骼肌肉啦，透過肌肉嘅收縮去擠壓個靜脈，就令到啲血咧繼續流動啦。但係當個肌肉去擠佢嘅時候，唔代表啲血永遠係向前行噶嘛，所以咧我哋就要靠反膜去避免血液倒流啦。咁所以你可以睇翻書本嘅呢幅圖啦。當肌肉收縮嘅時候咧，有啲血就向前行，就將個反膜打開；但係有啲血想向後行嘅時候咧，反膜就會閂埋咗啦。反膜咧就係靜脈嘅適應性特徵，去維持翻血管入面嘅血流啦。而第四個結構咧，我想講嘅就係動靜脈嘅內腔啦。動脈嘅內腔較為細，而靜脈嘅內腔較為大，咁又同佢哋維持血流有咩個關係呢？都係嗰句啦，由於喺靜脈嘅血壓咧較為低，所以一個大啲嘅內腔咧就可以減少到對呢個血流嘅阻力，就可以提升翻血流嘅速度啦，或者血流嘅分量啦。而左手邊呢幅圖啦，都係一個少少嘅歸納啦，去話翻俾大家聽啦。血壓咧隨住個動脈去到靜脈咧嗰個變化嘅。今次特別我想講嘅咧就係中間呢一 part，就係條題目冇 冇問過你嘅就係微血管啦。咁由於微血管嘅直徑好細，所以呢條血管嘅阻力咧係好高嘅，從而咧就導致到血壓下降啦。好，又嚟到一點出發嘅時候啦。今次嘅題目咧就由血管做切入嘅。講到血管啦，自不然係講緊動物、植物同埋微血管啦。今次就冇問你微血管嘅，下次問埋得唔得？梗係可以啦。另一個導向咧就係問翻血液循環啦。咁啊，有關於3款血管啦，結構、功能、適應性特徵就總要問你噶啦。今次咧就用 essay 嘅方式去問你，下次用下 MC 得唔得？梗係可以啦。用翻長題問你得唔得？又梗係可以啦。去到血液循環啦，心臟同埋骨骼肌肉咧都係參與喺其中嘅。咁佢哋兩者啦，當然都有啲適應性嘅特徵啦，尤其是心臟啦，心臟肌肉嘅厚度同佢所產生嘅血壓啦，有冇啲咩嘅關係呢？心室同埋心房嘅肌肉厚度有咩分別呢？左右兩邊嘅心臟肌肉個厚度又有啲咩分別呢？呢一個大家係一定要識嘅。而有關於血管啦、血液循環啦，亦都有一啲日常生活例子呢，佢都可以問你嘅。例如啦，當我哋捐血嘅時候呢，姑娘會俾嚿嘢我哋揸下揸下、捏下捏下嘅。點解我哋要咁做呢？咁啊，因為啦，當我哋捐血嘅時候呢，其實我哋係由個靜脈去取血嘅。因為靜脈咧係較為接近皮膚表面，容易啲去揾佢。而當我哋捐血嘅時候，揸下嘢，捏下嘢咧，手臂嘅肌肉就會 contract。而當骨骼肌肉收縮，就會擠壓到靜脈，而將啲血咧就泵離開我哋嘅手臂。呢個就係捐血嘅過程嚟啦。而成個循環系統，除咗血管之外啦，仲有啲咩嘢可以俾我哋比較呢？今次我哋唔係淨係講血管啦，講下血管同淋巴管有咩嘅相同，有咩嘅不同啦。3款嘅血球細胞又有啲咩相似，又有啲咩唔相似嘅地方啦。有甚或乎啦，人類同埋植物嘅運輸系統又有啲咩嘅分別呢？過往咧，梁 Sir 都拍咗一系列嘅短片，去幫大家去解除翻一啲讀 Bio 嘅心結嘅。好多同學都覺得咧，背咪得咯，死記硬背當然係方法啦，但係佢係咪最好嘅方法先？無論你中4、中5、中6，或者你係冇剔 Bio，但係你成日聽到人哋講 Bio 死記就得噶啦。係咪真係㗎？定係佢哋陰你㗎？咁我會將呢4段片嘅連結咧放翻喺留言區嘅。新一年咧，我祝大家聰明伶俐，學業進步，Bio成績更上一層樓啦。215 question 11 is about the blood circulation, and we focus on the arteries and the vein. Although both of them are the blood vessels, they are very different in their structures. And in this essay, we need to discuss how their structural differences are related to the different ways of maintaining blood flow inside the blood vessels. So let's take a look at the 3 steps. How can we construct our essay? Thinking time, any keywords, arteries, veins, structural difference, and maintain the blood flow. And any precaution, anything we need to write, anything we do not need to write. In this essay, there are 2 focuses. First is the structural difference. We need to compare the arteries and veins, the blood vessel wall thickness, valves present or absent, and the lumen size of them. And the second focus is about the function. How can they maintain the blood flow inside the blood vessels? And there are 4 factors for you to consider: blood pressure, blood volume, blood flow direction, and the blood content. And for the precaution, it's crucial step for us to eliminate some irrelevant concept. In this case, we need to eliminate the blood content because it's irrelevant to the functions of maintaining the blood flow inside the blood vessels. And for the scaffolding, how can we present our ideas in a better way? Firstly, we need to do the comparison. Firstly, we need to talk about the structural difference between the arteries and the vein. Therefore, we are going to do the comparison. And for the comparison, we call the synoptic skills. We need to do the complete comparison. And then we need to pair up the relevant structural difference with the significance in maintaining the blood flow. So that means we need to put the structure and the functions together. It's about the adaptive features of the arteries and the vein. Before we talk about the essay, please download the essay writing worksheet in the description or the comment section. When you are downloading the worksheet, I would like to have a brief introduction of the essay question. This essay question is about the comparison and description. So you can see this scaffolding. Firstly, we need to recall the adaptive features of the arteries and vein. As I mentioned, you need to relate the structure to the function to maintain the blood flow inside the blood vessels. Therefore, you need to pair up the correct and relevant structure with the specific function. But some students, they simply talk about the difference between the arteries and the vein. So let's see some wrong example. Arteries carry the blood being pumped by the action of the heart, but the driving force for the blood flow in vein is provided by the contraction of the skeletal muscle, which squeeze on the veins. So you can see that, oh, Mr. Leung, I mentioned the structure, the heart, and the skeletal muscle. And I also mentioned the blood flow, or the blood flow is maintained by the contraction of the skeletal muscle, or the blood flow in the artery is maintained by the pumping action of the heart. I talk about the structure, I talk about the function. Oh, 100 mark. No. You are not talking about the structure of the blood vessels. What are the structure you are talking about? You talk about the heart, you talk about the skeletal muscle, which are not the structures of the blood vessels. So we need to focus on the structure of the arteries and the veins, but not the heart itself, but not the skeletal muscles itself. So for this statement is not answering the question. And for the statement number 2, arteries carry the blood away from the heart, but veins carry the blood towards the heart. Mr. Leung, you can see that I'm talking about the blood flow. So what about the structure? You never talk about it in this statement. Artery, what are the structure? Veins, what are the structure you are talking about? You never mention it. So that's why you are not answering the question as well. And for the level 2, you need to compare the two relevant adaptive features. So that's why we need to recall the synoptic skills, which is the complete comparison. And when we are doing the comparison, we need to do the relevant comparison. And there are 2 examples for you. First example is about the lumen. The lumen of the vein is larger than that of the arteries. And the second example, arteries have a smaller lumen, but the veins have thinner elastic tissues. So you can see that which one is really the complete and relevant comparison. The first one. The second one is a wrong comparison. First statement, we talk about the lumen size of the artery. But for the second statement, it's talking about the vessel wall. And for the first statement, we really compare the lumen of the veins and the arteries. We can summarize the scaffolding by using this diagram. We compare the structural difference of the arteries and the vein, and then link it to the functions to maintain the blood flow inside the blood vessels. So let's take a look at the difference between the arteries and the vein to pick up the correct and relevant structural difference. So you can see that there are 8 difference between arteries and vein: blood flow direction, location, nature of the blood carry, driving force for the blood flow, blood pressure, wall, lumen, and the presence of valves. So what are the correct and relevant structural difference? Only these 3 are the correct and relevant structural difference. And all these 5, they are not. So let's take a look at the first pair of comparison. And the structure A I would like to compare in arteries and the vein is the muscular layer of the vessel wall. Arteries have the thicker muscular layer of the vessel wall, but veins, they have the thinner muscular layer of the vessel wall. And how is it related to the function maintaining the blood flow inside the blood vessel? We focus on the arteries. The blood pressure in the arteries is higher because of the pumping action of the heart, which drives the blood in arteries. Therefore, the thicker muscular layer in the vessel wall in arteries can withstand the higher blood pressure. But you may ask that, withstand the high blood pressure, how is it related to maintain the blood flow inside the blood vessel? The key idea is that if the muscular layer is so thin, just like in the vein or in the capillaries, there is no muscular layer of the vessel wall. So that means the blood vessel will be easily damaged by the high blood pressure. So that's why the blood, will they travel in the blood vessel? They will not travel in the blood vessel anymore. So you need to read the question carefully. The function is talking about to maintain the blood flow inside the blood vessels. So the muscular layer of the vessel wall can withstand the high blood pressure. It can prevent the arteries from being damaged by the high blood pressure, right? And for the second structure, structure B, I would like to talk about the elastic layer in the vessel wall. Arteries, they have more elastic tissue in the vessel wall, but the vein has less elastic tissue in the vessel wall. How is it related to the ways of maintaining the blood flow? We focus on the arteries as well. As I mentioned, the blood pressure in artery is higher. Therefore, the elastic nature of the arterial wall allows the recoil of the vessel wall. It can help us to maintain the blood flow along the arteries. And when the heart pumps the blood, there is a high pressure in the artery, so the elastic layer will be stretched up. However, the elastic layer, they will recoil and then push the blood forward. So it's the way to maintain the blood flow inside the blood vessels. And the structure C I would like to compare is the valves. In the arteries, there are no valves. But in the veins, there are valves. So how does this adaptive feature maintain the blood flow? We focus on the vein. So the blood pressure in vein is low as the blood pressure drops after blood passing through the capillaries. The blood flow in vein is maintained by the contraction of the adjacent skeletal muscles which squeeze the blood along. So you may ask that, no, Mr. Leung, I can talk about the skeletal muscle in the previous example, right? What a pity if you just talk about the skeletal muscle contraction and then squeeze the vein and then try to maintain the blood flow. It is not the structure of the vein, right? Because the skeletal muscle, they are the external structure, but not the structure of the blood vessel itself. So you need to talk about the valves. The presence of the valve can prevent the backflow of the blood. So you can see that from the textbook, how muscle contraction and the action of the valves help blood flow in the vein. When the muscle is contracting, so they will squeeze the vein and the blood flow, they will go up and the valve, they will be open. However, the blood, they also want to go back. However, they cannot because the valves, they are closed in order to prevent the backflow of the blood. And for the last structure I would like to compare is the lumen. Arteries, they have smaller lumen, but the vein, they have larger lumen. And how does this adaptive feature maintain the blood flow? We focus on the vein. As I mentioned, the blood pressure in the vein is lower, and the larger lumen in the vein can reduce the resistance to the blood flow. Therefore, it can increase the rate or amount of the blood flow inside the blood vessels. You can see this diagram as the summary of the change in blood pressure along different blood vessels. And I would like to mention the middle one. In the capillaries, the smaller diameter results in a high resistance to the blood flow. This leads to a significant drop in the blood pressure along the capillaries. And for the critical mapping, this question is talking about the blood vessels, artery, veins, and capillaries, and the other aspect is about the blood circulation. And for the blood vessels, the structure, the function, the adaptive features, you have to be able to recall them. And for the blood circulation, we can talk about the heart, we can talk about the skeletal muscle. They are involved in the blood circulation. And they also have the adaptive features, especially for the heart. The cardiac muscle thickness, you need to compare them. Muscle thickness of the atria and the ventricle, you need to be able to compare them. And you also need to compare the muscle thickness of the left ventricle and the right ventricle. And if we combine the concept of the blood vessels and the blood circulation, there are some daily life cases. And one of the possible question variation is talking about the blood donation. Why do we need to grab and squeeze an object during blood donation? And for the blood donation, we put the needle to collect the blood from our vein because the veins, they are a bit closer to the skin surface and easier to find. Why do we need to grab and squeeze an object? Because when we are squeezing the object, the muscle in the arm, they will contract, and the skeletal muscle contraction will squeeze the vein and force the blood flow out of our arm. And apart from the comparison among the blood vessels, we can compare a lot of things. The blood vessels and the lymph vessels, any similarity, any difference? And for the blood cells, red blood cell, white blood cell, and the blood platelet, any similarity, any difference? And also we can compare the transport in humans and the plants. And in the past, I have already made a lot of videos about the revision of the circulation, transport in humans, particularly for this inconvenient truth. Many students, when they chose biology as the elective, afraid of studying biology. They lose the interest because they think that they need to memorize everything. However, I need to clarify your concept. How do you study biology easily and happily? So please watch this video to clarify your concept of studying biology. And I hope that this video can inspire you to have a new way, a better way of studying biology in this new year.